I am currently a PA student here at UTRGV. Prior to PA school, I completed my Master of Public Health and Epidemiology. My focus is on local health disparities, and then I also did some global health. That was just kind of my way of like, hey, I want to see the world. I want to apply everything, right? So I did some work in federal as well, focusing on health disparities. But the focus is bridging the digital literacy gap. And it is primarily focused on the, we did an interdisciplinary educational intervention that bridged what we did as PA students with what we call AHEC, which is short for Area Health Education Centers. So that's a huge component of what I did. So I will start by discussing the current need to improve digital literacy, especially within our interprofessional collaboration with AHEC to learn about those digital literacy skills and those barriers, and then share how all of those professional students work together to really, take action against this. And then lastly, right, as a student, I want to provide my perspective, and then for other students as well, that it's possible. It's not just the profession; it's really as students, as we're getting there, we can kind of warm up to it. So AHEC. It's not just isolated to us. This is actually a federal program. Associated with the School of Medicine, we're with the School of Health Professions, which is why we're here today. But the School of Medicine really wanted to incorporate that IPE. Wants to, by introducing something called AHEC Scholars, which I will further define, wanted to bring in those professions and work together. The primary goal of AHEC is to help increase access to primary health care in those rural and medically underserved areas, which all around us. The population within these centers, one clinic down in Lower Valley, so Brownsville, the southmost area, and then 2 up here, which is La Victoria and San Carlos, which is here in Edinburg. And all of this is, like I said, medically underserved, low income, uninsured, or poorly insured, and primarily older population. So by their goal is really to use all of these and create this network between UTRGV, students, clinics, and the population, right, our community. So a little bit more, a diverse team of healthcare professionals, right? So it's a collaboration with the College of Health Professions, which brings on the PA students, you guys, right? Nursing students. We have a school of nursing, we have school of medicine, and school of social work. In my team in particular, like I said, we have 3 different clinics, and they try to assign us, if we're from the area, they try to assign us to the area in which we come from. So I'm from the Brownsville area, which is really great. You have that culturally sensitive approach. I understand what my patients feel. It's that as well, and I guess it just gives you a sense of fulfillment, but it also helps the patient more. And so within my team in Brownsville, my team in particular was medical students. I was a PA student with another student. We had nursing, both bachelor's and master of nursing students, social work, and addiction and rehab studies, which was kind of new. And that's what's great about AHEC. I think and the addiction and rehab was a new integration. And honestly, it was really great. As you see in what we did of our understanding from these interprofessional teams, right? So we have, these are my values, right? So role clarity. Doing your values and your goals, I probably can't, right? I may state something generally, but and that's kind of the point, right? So we have these weekly what the purpose of the profession is. Overcoming all of the time, but working in these teams can So it's like I may have an issue and I just have what I know from my box, but collaborating with somebody else may getting me outside of that, and all for one goal, right? Gain, but it's more so for the patient, it's more so for the community, for the environment. Collective leadership. So, and I think this one more is more. So I'm going into rotations in the fall, and I study hard, but I'm gonna get there. In our fields, but we're not experts, right? Really, much more so, we are not experts of everything that happens around us. And lastly, right, collaboration, and then innovation kind of box, right? So really, my last project, I'm going to be talking about 2 ideas, and the last project was kind of working on that, right? So using yourself within your profession as a student to something, but really derived from that interprofessional collaboration, right? Those ideas that you get from discussing with other people. So now, I wanted to talk about a little bit more specifically what we do as scholars. So we on individual development, but also that interprofessional collaboration. So they want us to learn more. They encourage us to go to conferences, to go to lectures, to do trainings. But within the AHEC program, like I said, we're dispersed into these teams. We have weekly meetings, and then they we're like, okay, well, what do we want to do, right? Like, I don't know, let's learn a little bit more of what we're doing about what we're in, and then we'll come back and discuss. So we used our week about our experiences, what we were doing. And through that, we encountered a lot of barriers. So our clinic is not in the greatest area, right? But it's meant for that. It's meant to address barriers that we already encounter. But even while offering while offering like telemedicine or anything to try to overcome some of these barriers. So a lot of the things that we saw were transportation barriers. So while we're placing our clinics in these rural areas, and like I said, it's, we have older populations. Do they have reliable transportation? Do they rely on somebody to get them there? If their schedules impede them getting there, can they drive there? Do they have a car? Do they have money for gas? The cost of the visit. So the AHEC clinics provide a $10 copay, which seems great, right? I think even $30, $40 copay, so that is like, oh my gosh. So $10 copay seems great for us, right? For a lot of people, if you or I keep getting letters. I can't afford that, right? So there's all these things, and then citizenship. Citizenship status. Do we have to be a resident? Do we have to be a citizen? So we talked about these things, and then I think the biggest point, because we were in emerging health factors. So how is it impacting the patient directly? So at the beginning, as we saw everywhere, all the clinics shut down, right? If they were seeing patients, telemedicine, and so our clinics thankfully did have that modality. We used some of the telemedicine platforms, but we still saw we were losing patients to follow up, and it's a population that really which was great. You know, we have one nurse practitioner who takes care of all the patients in the clinic, and she's great. And so we sat with our team like, well, hey, we saw these. I know that we can try to get them on the call, but then they lose the call. They don't have internet, or they don't know, like, I need them to turn the camera around so I can see their foot. It's like, but they don't know how to do that. And it's like the struggle there, right? So it also impacts the provider and her day-to-day schedule because of the lack of literacy, right? So it's like, okay, well, we have these. We discussed like, okay, we have these, we have some ideas. What's the need of, like, what is and Brownsville, which will constitute the RGV. So, column it says, or Rome, sorry, language other than English spoken at home. In the United States, and this is 20 data from the U.S. Census Bureau, states that 22% of the U.S. I should read this. At least that speak a language other than English at home. Just English. And then it's 85% in the Brownsville area, the region that I come from. So, and we know this is primarily Spanish, and it is only Spanish speaking, right? So, language component. Now, in terms, I wanted to point this out because I didn't highlight it, but it was interesting. Household 80%, so 90% across the U.S. And then in Brownsville 84%, right? But now then 77% in Edinburg. How to use it? Can you use it? Do you have the internet access to use it? So those were some of the barriers. And then just to kind of emphasize the population that we're working with, the Valley, about 30%, right? 30% across the board is persons without health insurance versus 10% across the nation. So that's pretty significant. And the ideas that we wanted to come across, I can take it. Okay, the provider's always looking for, well, I can only do so much within my means. Like I said, it's difficult for one provider. And additionally, do they have access? Do they know how to, do they have access to the internet? Do they know how to use it? Do they know how to find it? So our first idea, PDF, you can print it. And that's partially my passion that I'm just like, no, let's do it now, right? Educational intervention and then administer that. So the goal was to create an easy to read, easy to understand book that would have all the clinical and social resources that we are Bob Clark or Brownsville Clinic. And these were targeted to our patients and our patient population and the resources that they would need. The particular objective to provide those clinical resources for better self-management of their own health, their health conditions, to reduce the social barriers that we talked about by providing providing an between their field of study and then it's all pretty in pink when we're in school, but what encourages scholars to work in an interdisciplinary setting, right? So understand what each person has to bring to the table. Oh, here. So this is how we actually divided the work. So within my team, we had, like I said, PA, nursing, medical students, social work, and then the addiction studies, which was the newest one. And so we talked about it. How can we affect and create something that's going to be, so we said, okay, first, we really want to do the interdisciplinary thing. Let's mix everybody. Let's blend everybody. Because we learned this, the way you make teach everybody about it. So next time that we do this, guess what? We can work on that level, right? Because we're all on the same page. Is nursing on self-monitoring resources, and I'll break it down shortly. Medical students, clinical, more so like infographic, and then last one we focus on social and behavioral resources. Creating a resource director, like we said. Something where they need access to the internet, where's the how do I use them, right? So necessary and they were helpful for the patients. And so this included government resources, social resources, living resources, healthcare services, education, also suicide prevention, because we noticed that was a big thing, especially with COVID. Some of the infographics I included, just because it's kind of a big deal down here, right? So focusing on like hypertension, dyslipidemia, high cholesterol, and then diabetes, right? Type 2. So one of them was the do's and don'ts of insulin, right? So we prescribe insulin, here you go, but what happens? How do you manage it? What do you so that's where we try to put everything on there. With the focusing on depression. So it was the main problem that we had, especially in primary. We see patients again, and we say, okay, well, how have your blood pressure readings been? Change it to this medication. It's like, well, I'm not saying, right? Like, I don't know. It's like, well, you're supposed to be checking. It's like, well, I did, but I lost it, or I don't really know what I'm looking. Major things that we wanted to target, right? So creating or having access to a nice template, knowing what to put, where to put it, and something that just write it there every morning as soon as they got up, as well as their blood pressure. So, and then these are Diabetes Association and American Heart Association. And they had a hyperlink so they can just go straight to it if they needed more information. And then other helpful resources that we focus, and again, You have to put in, okay, I got my booster. Yes, I got my booster, right? So we use Athena Health, Doximity for telemedicine, so to actually see the provider. And then these are two that our provider consistently recommended. So GoodRx, because like I said, so just to try to find the best cost for their medications whenever they go into the pharmacy. And then lastly, my fitness pal, especially to help, track food or look. So to track either weight loss or weight gain. And then also help prevent suicide and stay alive, which are UTRGV. Really great. It was a great tool. We could email them to the patient if the patient had an address, and they can have it at all times. They can save it to books on their phone. They didn't need access. As if they didn't have that access, because she didn't have to go looking for all these resources. She now has a book where everything is, right? So it's really helpful for her as well. So now kind of leading into the educational intervention, right? How all of that approach, how all of that work. Like I said, I'm very like, I need to do something. I need to do something. Okay, how can we take an active approach? So we notice that we have these issues. Teacher patient, if we're seeing the same patients over and over, like, hey. From that stemmed the PASTT project, which is short for Physician Assistant Students Teach. And that's what they kind of wanted to get out, right? Get, advertise the PA profession. What do we? Was PA student led? Really successful because of that interprofessional that we worked on together. We use that for this. So now a little bit more past is education. And those health disparities within our clinics. The focus was to address the digital literacy barrier, number one, improve that continuity. No, how to mute, how to show the video, how to turn that camera around, right? Like we mentioned, showing the provider where the lesion is or where something is, and then integrating that AHEC, all that collaboration, all those meetings, using all of that for this. So just an overview of what we did, and Abram here actually was one of the PA students that led the sessions, and it was really amazing. So it was an 8-week session, and we started off with the basics, right? Okay, do you have a smart device? Great, bring it. If you don't have one, our grant covered mobile devices, so we could provide. Right, because we are all active learners. We need to. And introducing Zoom, because Zoom, I mean, and within the clinics, the other clinics that we, psychiatry clinics and their patients through Zoom. And so we said, okay, you know what, this is the primary modality that we want to use. From there, okay, we're online, right? Now we want to teach you And so that's what we did. We focused on, teaching, right, educating. And then from there, introduce Doximity, which is what we use. Let's have some sessions where you get to practice. Hey, you know what? Let's introduce Athena, right? Now you get lab results from your home, from just a click of a button. Like I have to drive out there to have my results printed. Show it to my doctor. It's like, okay, here we go. I can email it. We had to start off in person. To introduce anything new, you have to. And we said, okay, another one of the problems was that follow-up, right, with the blood glucose and the blood pressure monitoring. So we want you to log it, but do you know what you're doing? Do you know what those numbers mean? So, and honestly, that was a great session, right? They were so intrigued, and honestly, they're asking questions like, oh, and like, what's normal, what's not, right? So we provided probably take your blood pressure reading, and then also kind of the normal, abnormal, when you should see the doctor, when you should see, go to the ER. And then they also got to keep a vital signs kit at home to also reduce another barrier, right? And then week 7, we said, all right, we've done our job, it's your time, right? Show us what you've learned, sign on to Zoom, sign on to how you would show me your results, sign on to see the provider. And then, and we also had like an internet scavenger hunt where they had to go look for answers and resources and all of these things. So, and then the last week, it was, we did a loteria, so right? Yeah, we did I'll have some pictures of that. We were like, okay, what's this? Telehealth. And we did a couple sessions and like, that's it? Like, come on. I stated, we use this interprofessionally. We could not have done this. You should do this, you can get an idea, but are you doing it? Education, that collaboration into PASTT through these primary means, right? Utilization of that about the sessions throughout our patients and every single patient that comes. And so instead of having to look through pages or there it is. Oh, I didn't even know we had it here. So understanding that we have these barriers, a lot. So what are the barriers? What are some of the disparities that we're encountering? And so just kind of tying back so we maintain those values, right? Understanding our roles, understanding collaboration, that innovation, right? So the project came out of that, just sitting and talking. And then again, just tying it back with, we couldn't have really have done it without the help. Patient-centered care, achieved through interdisciplinary collaboration. And lastly, I just have some pictures of what think this was our loteria. So we did it, we did it virtually, and then they would unmute. Everybody was, and they're so happy. Look at them, they're just like. And just lastly, a special thanks to AHEC, the PA Foundation, and then of course all that supported us. You guys for listening to us here today. But I think in the future we would, and this time we really want to open it up just to everyone and say, okay, technically it's PA student led, we'll lead the sessions, but we are seeing it in teaching the, the vital signs. And I think social work as well. I think because of the COVID component, right, a lot of people are struggling and having access to these things, leading sessions. They're currently working on a session, right?
Behavior.
Yeah, behavioral sessions. Yeah, definitely. So it's, it's always developing. We can benefit our patients. So thank you. I'm here for any questions.